Liebe Kolleginnen und Kollegen,
Dear colleagues, hyperbaric activated oxygen therapy continues to prove itself as a worthwhile part of the general practitioner's practice. For several years I've been using this therapy to treat various indications, particularly cerebral and peripheral circulatory disorders, migraine, asthma, and to improve the quality of life of cancer patients.
und in der onkologischen Behandlung bei Krebspatienten zur Verbesserung der Lebensqualität.
Since this type of therapy has very limited side effects, we have had no problems at all in any of these treatments.
Keinerlei Probleme.
In a typical treatment, we draw 200 milliliters of blood from the patient into an infusion bottle. The ozone-oxygen mixture is added under pressure, which allows us to reintroduce a more highly saturated mixture to the patient. As I said before, I've been using this therapy for several years and would not, under any circumstances, wish to discontinue its use in my practice. The device can be set up directly before the treatment begins. To inhibit coagulation, we use 2,500 units of heparin sodium. The heparin is injected into the empty vacuum bottle through the rubber stopper at the point marked with a circle. The bottle is then clearly labeled. A viral filter is inserted into the connection to the precipitation reservoir trap. A Heidelberg extension is pushed onto the lure lock connection on the filter. The other end of the extension is attached to a size 1 cannula. To insert the cannula into the riser tube within the bottle, the stopper is penetrated at the point marked with a cross. The roll lock is pulled onto the trans-ozone set to the end and then closed. To connect the cannula, push it completely through the rubber stopper and hang the bottle on the tree. Turn on the device and check the vacuum display to determine whether the system is airtight. Push the button labeled Rinse and set the desired concentration. The system is filled with the ozone-oxygen mixture completely automatically. The process reduces the high vacuum within the bottle. After rinsing, the tube of the trans-ozone set is inserted into the air block head. Press the button labeled Vacuum, and a slight vacuum of 300 millibars will be created in the bottle. The system is now fully prepared and the line may be established to the patient. Immediately after establishing the line, open the tourniquet and the roll lock on the Heidelberg extension to allow the patient's blood to rise in the bottle. The vacuum in the bottle now will decrease. Using the vacuum button, you can maintain a balanced vacuum at 0.3 bar. During the procedure, the bottle should be swiveled from time to time to thoroughly mix the heparin and the blood to prevent coagulation. When the blood level reaches 170 milliliters, the ozone-oxygen mixture is prepared by depressing the button labeled Infusion. The gas reservoir is filled. When the blood level reaches 210 milliliters, half of the ozone-oxygen mixture is added to the blood by pushing the button labeled Pump. This additional volume of gas in the bottle forces the fresh blood contained in the trans-ozone set back into the vein, followed by blood mixed with heparin from the bottle. When the blood level reaches 200 milliliters, the roll lock on the trans-ozone set is shut off. The remaining ozone-oxygen mixture is now pumped into the bottle. The bottle is now approximately 0.85 bar. Turn the concentration to 0 and depress the infusion button once again. Shake the bottle to blend the blood with the ozone mixture. The high pressure within the bottle prevents erythrocytes from being damaged. Hemolysis cannot occur. In a matter of seconds, a clear change in blood color will occur. The ozone oxygen-rich blood will be light red. By slowly opening the roll lock, the oxygen-rich blood is reinfused into the patient. The decreasing pressure reading indicates the rate of reinfusion. The rate is controlled with the roll lock. If the pressure in the bottle falls below 0.8 bar, it can be increased by depressing the pump button. During the time the system is pressurized, the therapist must confirm its presence by depressing the foot switch once every 8 seconds. If he fails to do so, the system will automatically turn off the pressure after another 8 seconds. The airlock system also prevents gas from flowing toward the vein. After completing the treatment, the tube system is disposed of using standard practice. In clinical treatment, there are many applications for oxygen therapy. In surgery, it is used in amputations and to treat healing disorders, particularly abscesses and fistulas which are not healing successfully. The virucidal and bactericidal effects of ozone facilitate wound healing, granulation, and the epithelialization of tissue. An additional application in internal medicine is the treatment of impaired peripheral blood flow. Ozone therapy is particularly useful in treating leg ulcers, diabetic gangrene, Charcot's foot, and micro and macroangiopathies. By increasing erythrocyte elasticity and by enhancing oxygen supply in the capillaries, peripheral blood flow is improved. Asthma patients also clearly benefit from ozone therapy, experiencing relatively little distress and minimizing required medication. Results are also positive in treating restricted central blood flow problems such as migraine, vascular headache, trigeminal neuralgia, and circulatory eye difficulties. Last but not least, we should mention patients who suffer from exhaustion and extreme strain. They clearly benefit from oxygen therapy and show marked improvement after only a few treatments.